Danielle. I'm going to be your student physical therapist for today. Can you just confirm your name for me?
Veronica Osorio.
Nice to meet you, Veronica.
Nice
So
to meet you.
today we're going to be doing a cranial nerve test, just to make sure your nerves are working fine. We're going to begin with testing the first cranial nerve, which is the olfactory nerve. And what we're going to be doing is we're going to be placing these 3 different scents next to your nose, and then you're just going to tell me what you think the scent is. But you're going to be closing your eyes, and then you're going to be closing one nostril to test one, and then you're going to close the other nostril. Okay?
Okay.
So if we can begin, do you mind just closing your eyes for me? Okay, perfect. And then if you can block your right nostril for me. Very good. Okay, so here's the first scent. If you can just tell me what you smell.
Cinnamon.
Perfect. Here's the next one.
Coffee.
Very good. Next scent.
Sugar.
Awesome. Now keep those eyes closed for me and block the other nostril, and then you can open that one. Very good.
Coffee.
Awesome.
Cinnamon.
Very good. And this one, sorry.
Sugar.
Okay, awesome. And now you can open your eyes. That concludes our olfactory test. So now if her olfactory nerve was working perfectly fine, which it was, she'd be able to identify all 3 smells. If there was a unilateral lesion, she wouldn't be able to distinguish what the certain scent is, either with her left nostril or with her right nostril. Okay, so for cranial nerve 2, we're going to be testing your vision. To do that, I'm going to have you read off of this chart right here. First, you're going to do it with both eyes, and then I'm going to have you cover one eye and then cover the other eye. So we're going to start. So can you just identify the 4 rows for me, please?
Okay. The first one is Z, V. The second one is A, B, E, F, G. The third one is number 1, 2, 3, 7. The last one is Z, B, Q, L, number 8.
Okay, so now I want you to cover your left eye. All right, and then if you can identify the 3rd row for me, please.
1, 2, 3, 7.
Okay, and then can you do the 2nd row for me?
A, B, E, F, G.
Perfect. And then can you do the 1st row?
Z, V.
And the last row?
Z, B, Q, L, number 8.
Okay, now if you can do the other eye for me, please.
Z, V.
Okay, can you do 3rd row?
1, 2, 3, 7.
Okay.
A, B, E, F, G.
Perfect, and then the last row.
Z, B, Q, L, number 8.
Okay, good. So that is the first portion of the test. The second portion is going to test your pupillary reflex. So what that means is when I shine a light in your eye, your pupil is going to constrict. So we're going to start off with the left eye. So if you can cover the right eye for me. Yep, perfect. Okay, and then I'm just going to shine the light on your eye, and then it should constrict. Perfect. Okay, now you can relax both eyes, and then I'm going to have you cover the other eye, and then we're going to see if it constricts. And yep, did it right away. Perfect. So with a normal test, as she had, the patient is able to read off of the chart and identify the different letters and the numbers from varying distances, and they're able to do that with both eyes and then with one eye. And then for the pupillary reflex, their pupil should constrict when the light hits the eye. For a unilateral lesion, one side wouldn't be able to do that. So for example, if she had a unilateral lesion to her right eye wouldn't, the pupil wouldn't constrict, and then she wouldn't be able to read off of the chart. Okay, so next we're going to be testing cranial nerve 3, which is your oculomotor nerve. And this nerve, what it tests is just your ability for your eyes to move, your eye movement, and it also is going to test your consensual reflex. We're going to start with eye movement. So what you're going to do is you're going to follow my finger as I draw out a letter. Okay?
Okay, perfect.
All right. So just follow my fingers with your eyes. Perfect. And I'm going to do another letter. If you can just follow that around, good. And just another letter just to confirm. Perfect. Okay. The next portion is kind of like the last cranial nerve. I'm going to have you cover one eye, and then I'm going to shine a light in your eye, and then I'm going to see if the other pupil constricts as well. Okay, I'm just going to move your hair out of the way. Okay, perfect. All right. And there, your pupil dilated, and then and then that one dilated too. Perfect. So now if you can cover the other eye, and I'm going to let your eye relax for a second. All right. Now if you can cover that eye, perfect. And I'm going to shine a light on this one. And there, pupil constricts. And let's see if the other one did too. Yep, pupil constricts. So for a normal cranial nerve 3 test, first of all, when I was writing out the letters in the air, her eye would be able to go medial and go up. So they'd be able to adduct and move upwards. For the consensual reflex, when I shine a light in one eye, the other pupil should constrict. That's for a normal test. If there was an ipsilateral lesion, then she either wouldn't be able to adduct the eye, or she wouldn't be able to elevate the eye, either in her right or her left eye. And then for the consensual reflex, if I shine the light in the right eye, that pupil would constrict, but the other pupil wouldn't constrict. Or it can happen in the left eye. Okay, so next we're going to be testing your trochlear nerve, which is cranial nerve 4. For this one, it's going to be the same as the last one. I'm going to write out a letter in the air, and then I just want you to follow it with your eyes, okay? All right, so if you can just move your hair out of the way so I can see your eyes. Okay. So I want you to follow my fingers. Okay, perfect. All right, and up. Okay. Okay, and then one more time. Perfect, thank you very much. So for a normal trochlear nerve test, the eye, is able to move down and in, so it's able to adduct and depress. For a unilateral lesion, the eyeball wouldn't be able to do either of those. So if it was on the right side, her right eye would not be able to depress, and it wouldn't be able to adduct. Okay, so next we're going to be testing your cranial nerve 5, which is your trigeminal nerve. And I'm just going to test the sensations of your face, and I'm going to test if your muscles in your face that help you chew food are working correctly. So I'm going to be using this cotton ball, and I'm going to wipe it over your face, and then you're just going to point to where you feel it.
Okay.
Okay, so that's the first part. All right, so close your eyes for me. All right, and can you point to where you felt that? Cool. And then, very good. Okay, very good. And I'm going to do the other side. Good. Okay, awesome. So that means your sensations are intact. Now you can open your eyes. Okay, and I'm going to put this cotton ball close to your eye just to see if you blink. Okay? Good. Okay, perfect. So now we're going to test the motor portion of the trigeminal nerve. So as I told you, I'm just going to feel around the muscles of mastication, and I'm going to see if they're working properly. So I just want you to pretend like you're chewing for me. Good. Okay, and chew. Good. So this muscle, the masseter, is working. All right, and then I'm going to go up here, and can you chew for me? Perfect. The temporalis is working. Perfect. Okay. So if her cranial nerve is working well, the test would be as shown. So she'd feel the sensations around her face when I went over the 3 areas that the trigeminal nerve innervates. And then her corneal reflex would be working as shown. So when I put the cotton ball next to her eye, she'd blink. And then her muscles of mastication, which are the temporalis and the masseter, would be able to contract when she clenches her jaw or when she pretends to chew. If there was a unilateral lesion, she wouldn't be able to do that. So for example, her muscles of mastication, they wouldn't contract. And that would either be on the left or on the right side. Then for her corneal reflex, if I put a cotton ball over her left eye, for example, she wouldn't blink because the nerve wouldn't be working properly. And then for her sensations, if there was a unilateral lesion, she wouldn't be able to feel the cotton rub over either the left side of her face or the right side of her face. Okay, Veronica, so we're going to be testing your eye movement once again. We're going to be testing your abducens, which is cranial nerve 6. And this is going to be like the other test where I'm going to have you follow my fingers when I make a letter in the air. Okay, so we're going to start. First, I'm going to do the H. Perfect. The O. And then the Z. Perfect, very good. So if the cranial nerve is working as hers is, the test would show that the eye would be able to move laterally or abduct. If there was a unilateral lesion, her eye would not be able to abduct. Okay, so next we're going to be testing your facial nerve, which is cranial nerve 7. This nerve has 2 parts, motor and sensory, but we're only going to be testing motor right now. So what I'm going to have you do is I'm going to have you do a couple of facial expressions. If you can please smile for me. Perfect. Now if you can puff out your cheeks just like this. Very good. Now if you can raise an eyebrow or raise both. Perfect, very good. And now if I can have you blink both eyes, and now blink one eye, and blink the other eye. Perfect. So if her cranial nerve works, the cranial nerve test would be like she showed. Her muscles would be functioning and they'd be able to provide her with the facial expressions that she showed us. If there was a unilateral lesion, she wouldn't be able to control those muscles. So for example, she wouldn't be able to blink her left eye, or she wouldn't be able to smile fully, or she wouldn't be able to puff out her cheeks. Okay, so next we're going to be testing your vestibulocochlear nerve, which is cranial nerve 8. So for this one, I'm going to just be testing your hearing. So I'm going to have you close your eyes, and then I'm going to rub my fingers against your ear, and you're going to tell me if you heard that on the left or if you heard that on the right. So if you can just close your eyes for me. Perfect. And then what side is this on?
The left side.
Perfect. And where do you hear this?
Right side.
Okay. What about now?
Right side.
Okay. What about now?
Left side.
What about now?
Left.
Okay, perfect. So that's what a normal cranial test would look like. She'd be able to differentiate if the finger rubbing was on the left or if it was on the right. If there was a unilateral lesion, she wouldn't be able to differentiate completely. So if I rub my fingers on her left side, she wouldn't be able to hear it completely on that side. All right, thank you. Now I'm going to be testing cranial nerve 9 and 10, which is glossopharyngeal, and your vagus nerve. To test both of these, it's going to be 2 tests. The first test, I'm just going to have you open your mouth, say ah, and then I'm just going to see if the soft palate rises. And then for the second test, I'm just going to have you swallow, and I have to see if the muscles are working properly. I'm just going to be using this flashlight just to see if it elevates, okay? So if you can stick out your tongue for me and say ah. And perfect, that soft palate elevated. Very good. Okay, and now if you can pretend you're swallowing for me, and I'm just going to see if the muscles are working correctly. Perfect. All right, very good, Veronica. So if there is no lesions and the cranial nerve test comes out well, like it did for her, she would be able, her muscles would contract properly when swallowing. And then when she opens her mouth and sticks out her tongue, her soft palate would rise. If there was a unilateral lesion, either the muscles wouldn't work correctly either on the left side or the right side, depending on what side the lesion is on, or with her soft palate, it wouldn't fully rise on one side. So only, it wouldn't elevate correctly. Okay.